Hi, everyone, and welcome to the class. I'm recording this ahead of the presentation time so that I can be present in the chat room while you all are watching. So please ask any questions you have at any time, and I'll be as responsive as I can. We should also have a few minutes for questions via live video at the end of the class. Since we only have 2 hours today, I can't teach you everything there is to know about Lyme and TCM treatment. Lyme is very complex, often affects multiple systems of the body, and can lead to many different painful degenerative conditions. But every symptom that a patient presents with can be differentiated according to TCM principles. And when you do this properly, you treat their syndromes in the correct order, you can offer your patients a huge amount of relief. Chinese medicine has been treating chronic infections and degenerative conditions for thousands of years. Our pharmacopoeia has some of the most potent medicinals available on Earth, both for ridding the human body of infectious organisms and promoting health and recovery from chronic disease. This class is meant to help you get an overview understanding of Lyme as it presents in TCM Zang Fu diagnosis and treated according to 8-stage principles. You can offer a lot of help to a lot of people simply by diligently practicing what you learned in school if you differentiate symptoms properly and treat them in the correct order. If you want to go deeper with this kind of practice, I wholeheartedly recommend looking at the work of my mentor, Dr. Heiner Fruhoff, and his work on Goose syndrome. Whereas I am going to talk about Zang Fu diagnosis and 8-stage therapeutic principles working from exterior to interior, the foundation and beauty of the formulas predominantly involved in Gu treatment is using the 6 conformations of the Shanghan Lun as a conceptual framework for mixing all 8 of these stages together in a poetic way that reliably walks patients back to health. There is some nuance to that method, all of which we don't have time to cover in a 2-hour class, but Dr. Fruhoff has published a great deal of scholarly work on this that provides a good starting point if you want to further your own studies. Lyme disease is a complex and often polymicrobial condition affecting more than 300,000 people annually in the United States alone. While the pathomechanisms of acute Lyme are well understood and documented by biomedical science, the acceptance of the condition and its more chronic states remains controversial by public health authorities, diagnosis remains elusive for many patients, and treatments by literate medical providers are risky and largely unsupported by evidence. In this course, I'm going to unpack chronic Lyme for practitioners of traditional Chinese medicine so that you can understand what it is your patients are going through when they find out this is part of their picture. We'll take apart the symptoms these patients experience, how to differentiate them in TCM terms, and get into the basics of coming up with a comprehensive treatment plan. First, let's talk about acute exposure. Even though this class focuses on chronic Lyme always begins with acute Lyme, and it's important to have that grounding underneath you, understanding how to get into more chronic treatment. The most common way someone can contract Lyme disease is through the bite of a tick. Commonly, it's known that deer ticks are the ones to transmit Lyme. That's what's the most people are aware of. Evidence seems to be emerging that any tick is capable of carrying and transmitting Lyme. Ticks can carry and transmit Borrelia, the spirochete that causes Lyme disease, in either their nymph or adult life stages. But they are especially dangerous as nymphs because they are so small that their bites are almost never felt, and they can be very difficult to notice visually before the tick detaches itself. The size of a nymph or of a tick in its nymph stage of life is about as large as, I'm going to hold this up, this little dot on a sticky note. So as I pull this back, the camera stays focused on it. You can see that is very small. If that's on my skin somewhere, it's pretty unlikely that someone is going to notice it. People do see them from time to time, especially when they get a number of ticks on their body, but a single bite can be very, very easy to miss. Adult ticks are larger and more easy to find, but still not always caught and still rarely felt until they've been feeding on the host for some time and the tick's body has become engorged with blood. Other than a tick bite, there are a lot of hypotheses about how Lyme borreliosis can be transmitted. The only other method of transmission we know for certain is to be possible from mother to child in utero, but this does not happen 100% of the time. Some protection is offered from the mother to the child, but transmission does occasionally occur. Other than ticks, arachnids like spiders and some insects have been shown to carry Borrelia, but transmission to humans has not been proven to occur. And as Borrelia can be found in most body fluids or secretions from humans once they're infected, sexual transmission between humans may also be possible, but has not been concretely proven to occur either. There are a number of anecdotal cases that I've seen in my own practice where one partner knows they have Lyme, knows they were bit by a tick. The other one developed symptoms without a known bite occurring. They may have missed a bite, but it may also be possible for sexual transmission to occur. This hasn't been concretely proven, but hopefully over time we'll get better data on this. The classic symptoms of acute exposure to Borrelia are the erythema migrans rash. This is sometimes referred to as a target lesion or a bullseye rash. Flu-like symptoms, especially achiness, joint pains, headache, digestive problems, and occasionally neurological issues like Bell's palsy. In areas where Lyme disease is much more common than it is out here, I'm in Oregon on the West Coast. We do have Lyme in this part of the country, but it's not very common, not nearly as common as on the East Coast. Over there, and probably also in the Midwest, I know Lyme is much more common in the Midwest as well. Primary care providers and urgent care clinics automatically ask, if they see a patient with acute Bell's palsy, they ask, have you been sleeping outside? Have you been bit by a tick that you know of? Is it even possible? And sometimes they'll just run tests or even just administer antibiotics reflexively, because acute Bell's palsy can sometimes be the only symptom that someone presents with once they've been exposed to Borrelia. They may develop other symptoms later. We'll get into that as we discuss more chronic cases. But whereas Bell's palsy as a symptom can be effectively treated sometimes with steroids and sometimes with very conservative methods like acupuncture. Giving steroids to a patient who has Lyme is usually not a good idea. And whereas acupuncture can address the symptoms, it's not going to help rid the body of the infection. The most distinctive sign of acute infection is that rash, but unfortunately it occurs only in about 30% of infections that we know of. So it is possible to be bit and have Borrelia transmitted without getting an erythema migrans rash. The rash can take on many different types of appearance. If you Google erythema migrans or bullseye rash, in Google image search, you'll see a lot of different variation in how this can appear. It is frequently mistaken for other dermatological conditions, and it can appear anywhere on the body, not just the bite location. So urgent care and primary care providers will frequently mistake it for something else. The ones who are more familiar with acute Lyme know exactly what it is, and they just go ahead and treat. They don't even test. But if it's properly identified and treated appropriately in acute stages, this is the best chance that a patient has of being permanently cured of Lyme before it progresses into a more chronic and difficult situation. When we're dealing with chronic conditions, with chronic Lyme, we use the term remission. We don't use cure, because you will never eliminate all of the infectious load. And it's not possible that we know of, and doing so would require using extremely harsh treatment methods like chronic antibiotics, which I'll talk a bit more about, which have a lot of danger associated with them as well. Where you want to get your patients is to a place where the infectious load is so low and so well recognized by their own immune system that they are able to keep it in check for the rest of their lives. Clinicians living in areas where Lyme disease is very common will often correctly recognize the signs of acute Borrelia and forgo diagnostic testing in favor of beginning treatment as quickly as possible. In parts of the country where it's less common, they may order diagnostic tests. An acute Lyme diagnosis is often made using a two-stage process of testing with first the ELISA test and then the Western blot. This will miss many positive cases, as the ELISA test has a very high false negativity rate, and Western blot interpretation is not always correct and requires some nuanced and there's some fudging that goes on with that. So CDC requires 5 positive bands on a Western blot for a case to be reportable to public health authorities. That's the gold standard for a laboratory diagnosis. there's some controversy around this, as many clinicians who have made clinical diagnoses of Lyme in their patients see fewer than 5 positive bands. But those patients respond appropriately to correct treatment. And sometimes they'll even show a Herxheimer reaction, which is a positive sign that's a sign of bacterial die-off. And I'll talk about that in a little more depth when we get into wind. When properly identified as acute Lyme disease, patients should be referred to a provider who has prescribing privileges and given a 30-day course of doxycycline or other antibiotics. If you're interested in learning more about this method, this is the biomedical standard of care for acute Lyme. I recommend the Training on Lyme Disease by ILADS, as they have the best evidence-based guidelines for acute treatment. When a Lyme infection is not properly identified in its acute stages, antibiotic treatment becomes less effective and is more controversial. It may be recommended by primary care providers and practitioners who consider themselves Lyme literate. However, the longer courses of antibiotics have an extremely limited evidence base. And so many of the patients who will come to the practice of a Chinese medicine professional have been through these treatments already. They will relate stories to you of how painful and ineffective they were. When patients take a prescription from a doctor who claims to be capable of treating chronic Lyme with long courses of multiple rotating antibiotics, they will take that prescription to a pharmacist, and the pharmacist will often counsel them against filling the prescription. There are cases of case reports in the literature of people being severely negatively affected by long-term antibiotic use. There are also cases of people who have recovered using that. But it's antibiotics not in my scope of practice as an acupuncturist, but from a TCM perspective, we know that those medicines are typically very cold and very bitter. So they can be substances that are life-saving in a Yang-Ming syndrome, where anywhere you would consider prescribing herbs such as Huanglian, but they will quickly injure the Taiyang and Taiyin networks and create a very cold and damp constitution, which can lead to people being more prone to lingering pathogens, a lot of phlegm buildup, and it can make it harder to treat the remaining infectious agents. A note on co-infections. In the world of Lyme treatment, we typically like to say that Borrelia opens the door, and in this sense, it is very much a wind phenomenon. Borrelia is without a doubt the spirochete that causes Lyme disease, but it has many friends, and chronic Lyme patients will, if tested, often show overgrowth of yeast or be diagnosed with what we call candida, or what gets called candida. I don't actually tell people with that. We all have candida in our digestive tracts. It favors cold and damp environments, as it's a yeast. It can easily grow out of balance with other microbes in our microbiome, but we're never trying to eradicate it completely. We're just trying to warm the middle jowl, dry it out to the place where candida lives in a healthy, happy balance with the other microflora. These patients may also test positive for many co-infections: Babesia, Rickettsia, Ehrlichia, Bartonella, Epstein-Barr virus titers, or human herpes 6 virus. Antibodies may be chronically elevated. These are they're called chronic viruses that can be reactivated by bacterial infections. When bacteria are biofilm producing, they can trigger the reactivation of an old virus. And it's looking from the data we have, the patient reports we're seeing of people with long COVID, that the SARS-CoV-2 virus that causes COVID may be something else that kind of ends up existing in this category. It can come and go, very much a damp kind of situation. These patients may have parasites. They may test positive for exposure to environmental toxicity, such as heavy metal poisoning, microplastics, or pesticide residues, and they may show injury incurred by exposure to molds such as Stachybotrys. So when people become more of a damp type of constitution, which is what often occurs with chronic Lyme infection, dampness creates other dampness. Dampness tends to accumulate more pathogens. So anything people are exposed to in their environment, they're going to hold on to it. They build phlegm around it to protect themselves, but stuff can continue to repopulate, to grow, and to be stored by the body in there. So it's important to know that while Borrelia is the spirochete that causes Lyme disease, other infectious agents are likely to be a part of that patient's overall pathological picture. We're never working on eliminating just one bug. All of these work together to create a polymicrobial milieu that works against a patient's yang qi and can erode their health insidiously over time. It is important to work with a diligent, slow, methodical approach to these patients, as they will not get better permanently overnight and may require ongoing maintenance care once they have returned to a state of good health in order to maintain that good health. I'll talk about maintenance care at the end. Most patients don't need to take herbs for the rest of their life. In Chinese medicine, we understand that we are never fighting against just one infectious or disease-causing agent. We are working to harmonize the component species of a patient's microbiome to create a diverse and flourishing garden of health. So antibiotics, the whole paradigm of medicine that those are used around is eliminating, it's like using a nuclear bomb to eliminate one infectious agent, whereas that has tremendous auxiliary damage to the microbiome of the patient as a whole, and we know that that can set people up for other health problems later on. Chinese medicine, we're looking at the patient's body as a garden. We want to cultivate things that are healthy for that garden to thrive, and create an environment in which pathological species have a difficult time living and replicating. They're still there. They may always creep in, but they should be pushed back out again just as soon as they arrive. So let's talk about the classification of the stages of Lyme. These are the conventional CDC stages of Lyme disease. So this is not how we really look at things from a TCM perspective, but it's important that you know this if you're going to be treating this demographic. So the first stage is called early localized Lyme. This is acute. These are the earliest signs of infection, and they can occur hours, days, or sometimes even weeks after a tick bite, if patients show them at all. Some patients will not show any signs of infection and will not seek care. And this is where it can immediately go deeper, and it can even lie dormant in a patient for decades. They'll come to seek care later for something else, through a good history and potentially some good diagnostic testing, specifically that Western blot. You can uncover what is going on behind their symptoms. But the signs of acute early localized Lyme often include that skin rash we talked about, flu-like symptoms, fatigue, headache, stiff neck is very common, swollen lymph nodes, and they can be neck, axillary, groin, knee, etc., and a sore throat. From a TCM viewpoint, these signs are obviously in the exterior Fu bowels and Yang stages. I'll insert a note here that the one thing you typically will not see with acute Lyme infection is respiratory illness. So people will say, I feel like I've caught the flu, but it's not going into my lungs. That's one thing to consider with this. The pathogens, they're in that exterior Fu and Yang stages. They have not yet had a chance to penetrate deeper into yin tissues and organs. And this is why antibiotics, when properly administered, can be curative. I rarely see this presentation in my own clinic. Most people will go seek conventional care when this happens. But when I do, I treat appropriately with exterior releasing methods. So I will, if we know or strongly suspect that acute Lyme exposure has occurred, I refer out for an antibiotic prescription. But you can still use Chinese herbs to support that working in this situation. So the main formulas we utilize here are the ones, I'll talk about these a little bit more in the wind section, but they're focused on releasing the exterior. The pathogen is still in the skin, in the lymph. You can encourage the patient to sweat it out. So we're using things like guijitang, yin chao san can be used here, sha chai hu tang, chaiga jieji tang. This is fantastic for releasing the muscle layer when you have that stiff neck presentation. Or sometimes that's guijia gugen tang, but gugen is in both of those formulas. That's a wonderful herb for that. And then if they're having more of that replete fever, and you feel like it's in the Yangming stage or getting into the blood, you can use some more bitter substances. And this would be things like Yin Chen Hao Tang or Da Chai Hu Tang, Huangnian Jedutang, or even Daigasan, which has like Qingdai, that indigo. These are some of the formulas that are best used at the beginning stages of chronic treatment as well. And in this early stage of acute Lyme, we're mostly focused on treating wind and damp heat, and the yang qi of the patient has not yet been severely injured. Now, if this is a patient who had a pre-existing yang deficiency, you may not see all of these wind signs. The pathogen may just seep immediately into the yin organs, and then that's a more difficult scenario to be treated. And that's also where acute antibiotics probably should be used, because any yang qi that patient has is going to be recruited towards manifesting a very hot inflammatory condition. But they will almost certainly need tie-in support, middle jiao support, and they're more likely to experience post-treatment Lyme disease syndrome, which I'll talk about in a moment here. The other formula to consider at this stage, the early and acute stage, is Jiajian Suhatang. So this is not one that's commonly taught in TCM school. Heiner has written extensively about this formula. His earliest articles on Lyme discuss it in depth and actually take apart its component herbs and describe how they're used. I'll talk about that a bit more in a later section of this lecture. But that formula is also the basis for the thunder and lightning pearls, which are sort of the hallmark initial stage of goo treatment formulas from that line. Stage 2 is early disseminated Lyme. So this begins to occur weeks or months after the initial infection if it is not recognized and treated properly. As the infection persists, it drives deeper into tissues. You'll see symptoms in patients begin to change. Some of the acute symptoms may persist, but now becomes the possibility of the pathogens affecting the tai-yin, shao-yin, and even jui-yin organ networks, and the development of symptoms like weakness and numbness, vision changes, deeper and more persistent body pain, and often this will be diagnosed as rheumatoid arthritis or fibromyalgia. Cardiac problems, especially chest pain and heart palpitations, and then neurological issues such as Bell's palsy. So Bell's palsy can be a wind phenomenon. We know when we're treating this with TCM principles, this is typically associated with wind and phlegm. But in Lyme, that's classified as part of stage 2. So I think it's still part of an acute picture for many people, especially when that's the only symptom that they experience. But that development of phlegm with the wind usually means that those patients are in a little bit more severe state, especially if the Bell's palsy is the only symptom that they'll manifest. And then stage 3 is what CDC calls late disseminated Lyme. And this is where we get into the term that where we start calling things chronic Lyme. So this is where most Lyme patients who present in a TCM clinic will be found. It's difficult to obtain a diagnosis at this point from many Western medical professionals. Many patients will have been going from doctor to doctor for years without obtaining a concrete diagnosis, and often will have been sent along their way with a prescription for ibuprofen and antidepressants, but symptoms will persist or worsen regardless. Attempts at palliative care may be all they can receive biomedically, but TCM has a lot more to offer. So any of the previous stages symptoms can still be present in this scenario, but they will also commonly be joined by long-term chronic arthritis, especially transient polyarthralgias, arthritis affecting multiple areas of the body, which they move around, they come and go, chronic headaches or migraines, dizziness and vertigo, connective tissue disorders, especially the ones involving pain, sleep difficulties, mental and emotional disorders, especially anxiety and depression, but more serious psychiatric illnesses can be attributed to Lyme. There's a growing evidence base for Lyme triggering more severe psychiatric issues. Brain fog and concentration problems are very common, almost universal in this demographic. And then some more advanced neurological issues. These patients will often have idiopathic neuropathies, which can also be transient. They be there for a long time, and then all of a sudden they're gone, and then they come back just as quickly without warning or known triggers. Dementia can be a sign of advanced Lyme disease and possibly other syndromes. And a note on dementia, there's some really interesting data showing the presence of Borrelia inside of the beta amyloid plaques associated with Alzheimer's disease. So I don't think all Alzheimer's is caused by Lyme, but I think that having a long-term undiagnosed Borrelia infection can definitely lead to certain kinds of dementia. And then other neurological syndromes may develop as well out of this. And we know from a lot of the co-infections of Lyme, especially things like Epstein-Barr virus, that there's a strong correlation between having that for a long time and developing syndromes like MS. And so, you know, whereas most of the scenarios I'm laying out, most of these symptoms and syndromes are tied very closely to Borrelia, you know, knowing that there are very likely other chronic infectious agents present in the body at the same time, and that the patient's yang-qi, their ability to manifest health, their ability to fight off disease, is being eaten away. They're being hollowed out over many, many years. It's probably making it more likely that some of those worst case scenario options from the other infectious agents are going to manifest. These people also will have digestive problems of any and every kind. And while this is a bit nebulous to talk about, it's quite possible that basically any system of the body can be affected by chronic Lyme, and especially its co-infections. So sometimes you'll see people who have, you know, very random, very weird, transient, especially syndromes. And again, taking a thorough history, doing diagnostic testing can lead to discovering this, and then, you know, hopefully creating a situation where you can administer effective treatment. So because these patients have had so much trouble trying to obtain a diagnosis and treatment from biomedicine, many of them will be frustrated and have gone years enduring dismissive attitudes from their providers. It is our job as clinicians to meet them with compassion and dignity and hold their hand, walking them back to as much of a semblance of normalcy in their lives as we can help them to attain. A note on terminology here: the term chronic Lyme is not an ICD-10 diagnosis. So according to CDC and many other public health agencies, once a patient has been treated with antibiotics at any stage of Lyme disease, they should be cured. This can be shown to be untrue in untold thousands of cases, but nevertheless, they will be given the diagnosis once they've been through that treatment of post-treatment Lyme disease syndrome. And then they're usually told that they should recover from that in 6 months with conservative care using ibuprofen and antidepressant medications. Few of them will. So post-treatment Lyme disease syndrome is a syndrome that does occur. And I feel it should more accurately be named post-antibiotic treatment syndrome. It's very clearly damage to the middle jowl, damage to the tie-in spleen and lung from improperly or overused bitter and cold medicinal substances. And this will predispose patients to a damp type of body pain, damp type of other symptoms, and of course, depressive moods. And this can be treated effectively by Chinese medicine. So when we refer out for antibiotic treatment in the acute stages, it is still responsible to let your patients know they may experience that kind of a syndrome after using antibiotics. 30 days of doxycycline is not a short course of antibiotic treatment. That is what they should do at that point. But if they are feeling really low afterwards, they should come back to see you, and where you start using, you know, appropriate middle jowl strategies, warming and drying the spleen, not using too many tonics, but, you know, acupuncture, moxibustion, even just having a compassionate provider who listens to them and treats them like a human being can be very, you know, that therapeutic relationship can be very powerful, and you can help them recover from the antibiotic treatment. But I feel like throwing that term post-treatment Lyme disease syndrome at every patient who has used antibiotics and then been pronounced cured when they're obviously not is irresponsible. So PTLDS is real, but many patients who've been treated with antibiotics or treated at the wrong stage with antibiotics will not be cured. And then basically I've seen patients who they feel like they've been gaslighted by their doctors, told that all they have is this post-treatment syndrome, when clearly there is still some kind of chronic infection going on in their body. So unpacking chronic cases in TCM terminology. Well, every chronic Lyme patient you see will be different in their presentations. No two are going to be the same. A few commonalities do tend to occur. And one is that multiple systems of the body will almost always be affected. Pardon me. And thus it is incredibly likely that more than one TCM syndrome differentiation will be present. In order to properly create a treatment plan that will help your patients get all the way through to remission, it's important to create a complete picture of their physiology and pathology in TCM terms on the first visit. So this way you can give the patient, and of course, probably more importantly, give yourself a roadmap to follow as you walk the pathogens out of their body and help them to recover. You're planning a very long journey for this patient. So I've seen patients with chronic Lyme who are young, healthy, and haven't been sick that long recover very fast, 3 months, 6 months. But many, if not most, of the chronic Lyme folks that I see in my practice take 6 months to really feel like they're making progress. It's a full year until they feel like they're starting to get their lives back. And then at 18 months is when we start kind of thinking about using the term remission, but it can easily be a lot longer than that. It can be 3 years, it can even be 5 years. And having a roadmap to follow is key to not getting pushed off track constantly or getting thrown around by every new change that the patient experiences and then relates to you. So if you want to stay the course in this treatment, because the predominant paradigm for treating chronic Lyme is looking at this through the lens of glue syndrome and dampness from a TCM term or a TCM kind of view. And you've got to tease that out bit by bit. You can't just wipe it out immediately. And having a roadmap to follow, knowing the stages of treatment yourself, knowing what your patients are going to experience before they have it happen, and telling them gives them a lot of confidence and also reinforces your own confidence in what you're doing. So as the patient goes through different stages of treatment, it's easy to be thrown off course by what they're reporting, but knowing that you're going to stay the course and see it through, you're going to be treating that wind until you are very quite sure that the wind element is gone, until it comes up again. And then maybe you give it a little nod, but mostly at that point, you're focused on dampness. And you treat dampness till that's basically dried up. And then you may still see some dampness and wind. You give a nod to that, but then you're on to chi stagnation and blood stasis. And, the first visit with the patient, do a comprehensive history, get all of their symptoms written down, categorize everything in terms of TCM pathology, and then create your treatment plan. You'll most often see a very large and wide mix of both excess and deficiency patterns that are present. The first stages of treatment are usually weighted much more heavily towards reducing excess, but we don't ever disregard the significance of deficiency, particularly yang deficiency, as the long journey of dealing with multiple infections in a society which keeps us all perpetually overstimulated and exhausted tends to deplete yang qi, especially in middle-aged or older adults. One of my favorite questions to ask a new patient is, when was the last time you had a nice high fever? Very often their answer will be that they cannot remember, or that it has been decades or even since childhood, since their body temperature rose above 100 degrees. Multiple times in my career, after many months of treatment with yang tonics like Futsa, patients will, with a mix of both happy and tragic emotions, let me know that they've contracted some kind of acute illness and spiked a nice high fever. They feel terrible in the moment, but are happy their immune system is showing signs of health. Inevitably, this is the turning point in their recovery. This can also be part of a Herxheimer pattern, a Herxheimer reaction situation, which I'll talk about in a moment. So from a TCM perspective, the 3 main stages of treatment that your patients are going to go through. One, you're going to reduce the pathogenic load. You're going to reduce all the excesses you see: wind, dampness, chi stagnation, blood stasis, heat, and cold will go with that. Two, you're going to keep the pathogenic load at bay, supporting the recovery of the patient's yang qi. So this is where the formulas tend to be mixed a little bit more 50-50 in terms of reducing excess and building up tonifying deficiency. This stage is laden with the potential pitfalls and booby traps, and I'll talk about that a bit more later on. And then the third stage is you want to cement that yang recovery. You want to fortify the patient's body against new infection or against having recurrences of old infection. So those chronic viruses, once they're in your body, you're never free of them. You know, it's like you get chickenpox as a kid, and then when you're 85, you get shingles. It's the same virus. It's been with you your whole life. Um, uh, you just want to, you know, by building up the strength of a patient's immune system, by helping them deal with the stresses that life inevitably throws at them, with new infections, et cetera, as they're exposed to things, you're going to help them stay safe from having a flare up again of all of their Lyme symptoms. So each of these stages can take some time. Typically, as I said before, I'll tell patients that the first 3 to 6 months of treatment will be focused on reducing the pathogenic load of any organisms keeping their microbiome out of balance. They will feel significant relief of many symptoms during this time, but may have lingering issues or feel that they're in a very delicate state, even though their pain is reduced, their energy is starting to get better. And it will be very easy for them to overdo things. I'll repeat this again, but it's important to consistently coach your patients with a chronic infection that just because they're feeling better should not give them a license to burn themselves out again. Burnout is going to lead to another flare, inevitably. Once the patient graduates into the second stage of treatment, it's key that they adopt a sincere practice of self-care. They will feel an urge to return to a state of perpetual burnout, but must be swayed from doing so. They typically should eat this is like the most spleen diet you can think of, a very bland, cooked, nourishing foods for most of their meals. Exceptions, of course, can be made, holidays, birthdays, etc. But, you know, staying that middle ground, congee, soups, you know, not a lot of sweets, not a lot of alcohol, not even a lot of spicy things. And leading a fairly boring lifestyle can also be quite therapeutic for these people, emphasizing things like moderate exercise, adequate rest, contemplative practices, self-reflection, etc. After 6 months of this stage, without a major relapse, we can move into stage 3. The third stage is in some ways the most difficult, as patients may not feel any symptoms, but by using tongue and pulse diagnosis, and just your experience as a clinician, you'll be able to discern that their body's defenses and strength have not yet returned to the degree that they can stop taking herbs. They will know this when they get into a winter, as the exposure to cold and damp weather can often make them come out of remission. So once a patient has made it through a winter without a major relapse, I consider them fully into remission. In an ideal situation, this takes 1 to 3 years, but some exceptional patients will require longer courses of treatment, up to 5 years with consistent herbal medicine, and need to cultivate a serious medical Qigong practice for themselves to stay free of relapse. There have been a couple of patients in my practice who need to take herbs indefinitely. When they're into a remission-like scenario with this, they just continue to be very delicate. This is usually when the deficiency has come down to the level of Jing, and they're very old. And so, you know, they've been sick for a very long time. Most of their symptoms are gone, but they need to continually take herbs to stay well. And that's in addition to medical Qigong. So medical Qigong practice is the maintenance care that I recommend for most of my patients. It's simple Yangshan, you know, life-preserving kinds of practices, not burning themselves out, understanding their limits, setting the boundaries is key for many of these people. And they may need an occasional course of herbs in the future. They may catch an acute flu and feel like they're having a very mild relapse of their Lyme symptoms. It's usually easy to treat. It doesn't take that long, and then they're fine, and you don't see them for a couple more years. So let's start talking about pathogenic factors and stages of chronic treatment with Chinese medicine, breaking this down a bit more. So the first factor that we're going to discuss is wind. So just as we say that Borrelia opens the door to other pathogens, wind as a pathogenic factor in TCM terms also opens the body up to injury by other pathological influences. These are dampness, heat, cold, etc. As the pathogens involved in chronic Lyme penetrate into deeper and deeper aspects of the body, the wind can also be encapsulated in dampness and phlegm or drawn into the blood. And so, whereas in the beginning, we are often using formulas that are very releasing of the exterior. These are Guizhitang, Xiaotaihutang, Jiajiangsuhetang that are primarily indicated for wind invasion. When we get to later stages of treatment, we may be using formulas meant more for internal conditions, but we are still adding on Guiyao pairs of herbs to relieve wind, such as Jininhuan Lianqiao or Baijiu and Changhuo. That's great for wind types of headaches. You can also consider formula combining or even modifying formulas originally meant for exterior conditions with herbs or doses that will have an interior effect. So just to break down one of my favorite formulas in this circumstance, Guizhitang. You can use Guizhitang for basically any of the 12 organs with correct modification. And whereas we typically think of this as, wind cold, we know that Guizhou and Baishao also have those are the two main ingredients in that formula, cinnamon and peony. They have a very yang and yin relationship affecting the yin and wei levels. So if you increase the amount of Guizhou relative to Baishao, you're tonifying yang, you're opening the pores, you're promoting sweating, and you're pushing things out that way. When you switch that ratio and you're using more Baishao, its sour flavor is going to astringe the action of the formulas deeper into the nutritive layer. So if somebody is still a very Taiyang type of constitution, but you're seeing that the effects of that affecting their blood, their liver, their sinews more, you double the Baishao, you're drawing that action of the Guizhitang into a different layer of the body, but still releasing wind. The classic signs of wind are symptoms that move and change throughout the body. So this can be itching, some kinds of neuropathy, that crawling, skin rashes, dizziness, and wandering pain. These can all be associated with wind. And then at this beginning stage of treatment, so we're in the first stages of chronic treatment now. It's important for me to mention the Jarisch-Herxheimer reaction. So if you get involved in Lyme discussion boards or you start treating patients in this demographic, you're going to hear about Herxing or a Herxheimer reaction a lot. It's important to know what this is and what this isn't. So the Herxheimer reaction is a biomedical phenomenon. This occurs when bacterial infections are being successfully slaughtered inside a human body and lipopolysaccharides are being released into the bloodstream. So lipopolysaccharides are components of the bacterial cells that are highly toxic and inflammatory, and they tend to produce a very unpleasant scenario for the patient. It can be mild or severe, and in certain circumstances may even require hospitalization or at least very close medical monitoring. So when I take on a new patient with chronic Lyme, I will let them know that this is a potential reaction they may experience when they start taking herbs. It can happen with antibiotics. It can happen with herbs that have an antimicrobial action inside the human body. Most often it occurs at the very beginning of treatment, as their formula will be more heavily weighted towards reducing an infectious load. However, in some situations, it will not happen until a specific tissue type is being targeted, where we assume a large colony of infectious organisms have taken up residence. As those critters are being destroyed by the herbs, the newfound strength of the patient's immune system emerges. That inflammatory reaction of the immune system hitting those bacterial die-off components can cause a lot of pain, a lot of gut problems. They can have a fever if they have enough yang qi to produce one. Very often strange health crises will reemerge that the patient has experienced in their past. So these are very often physical, but they can also be psychological. So patients with a a history of childhood trauma sometimes will feel like that trauma is being reactivated, and they're being attacked again, even when they're in, as close to a sterile environment or a safe environment as they can be. It's inflammation in their brain, in their neurological system, that's causing this to occur. And then sometimes this can be very physical. So in terms of patients kind of rowing the boat upstream or going back in time and experiencing health problems that they've had in the past. So most of the time, a Herxheimer reaction is fairly straightforward. It looks like kind of an acute flu or an acute Lyme exposure again. But I had a patient who she had a history of transient idiopathic liver failure. It came on suddenly. She had no idea where it came from. She was admitted to the hospital. They had her on a transplant list for a new liver, and then all of a sudden, just as quickly as it came on, it left, and her liver seemed to be fine. This had happened a long time before she came in to see me for Lyme treatment. We started Lyme treatment. She immediately went into early signs of liver failure again. She didn't have to go back to the hospital. We adjusted the dose of her formula, which I'll talk about in a second. We changed some lifestyle practices she was doing. She had to stop drinking alcohol. But again, that was part of the Herxheimer picture for her. The bacterial die-off, I assume, was just so toxic for her body that compromised liver then went back into failure. And it went away as soon as she cleared the lipopolysaccharide toxicity, and then she was fine. She still required long-term treatment, but once the Herxheimer reaction is over, it's like a rite of passage or an initiation into a long healing journey, and people don't usually have it more than once. In that scenario I talk about where you're digging deeper into a new layer of tissue or an organ system of the body you haven't really targeted with your formulas before. There's something lingering in there that wasn't affected before. Patients can have a second Herx, but that's pretty unusual. It doesn't happen all the time. So when the Herxheimer reaction occurs, it's critical that the patient not stop taking their herbs unless they are having a medical emergency and getting admitted to the hospital. I have never seen someone in that severe of a scenario in my practice, but it has happened. So it is something to watch for, and be accessible to your patients when you start somebody on a new Lyme formula or a new patient on a Lyme formula, because that's something that can happen and it can be serious. The reaction is a good sign that the treatment is working, but it can be really unbearable. And if it is, you want to dial the dose back down a lot. So I will have patients reduce the dose by up to 90% of what they were taking. So say they were taking, this is just for easy math purposes, but if they're taking 10 grams of granules a day or 10 total capsules of a patent remedy, we'll bring that down to 1. And then if usually their symptoms will come down accordingly, 90% or so. They do need to take enough herbs to produce a reaction. So if they bring it down too low, they won't get any reaction because the herbs aren't working. But you want to make the symptoms tolerable for them. Everybody's tolerance to the Herxheimer reaction is different, just as every Herxheimer reaction is different in its severity. But you want to be consistent in the administration of herbs until that reaction passes on its own while they've been taking herbs consistently. And once that happens, it's usually over. The term Herx gets thrown around a lot in discussion boards, and it can apply to people who are going through treatment for or dealing with chronic mold exposure or mold injury, candidiasis, all kinds of chronic conditions. And it gets used incorrectly a lot of the time, where people will say, oh, I walked into a candle store and I started herxing. That's a hypersensitivity reaction, but it's not a Herxheimer reaction. And you don't need to get into arguments with your patients to teach them how to use this correctly. But I feel as a clinician, it's important that we use the correct terminology. So people who constantly react to everything in their environment, that sometimes that's called a herx. It's not actually a herx. Next up is dampness and phlegm. So with your formulas, you always want to be aware that wind is a primary pathological factor in chronic Lyme disease. If you're going to overtreat in the direction of wind. But we're also really heavily weighing our formulas towards dampness and phlegm because these are predominantly damp types of conditions. These patients have a lot of biofilm, mucus, bloating, water retention, water metabolism problems. And then, this is one of those areas where these first two stages of differentiation and treatment are the most important. And I'm going to repeat this point again and again. So because of modern diet and lifestyles where we're all eating too much rich food, refined sugar, alcohol, dairy products, too much food, period, almost every American has some amount of excess dampness and or phlegm in their body. You combine this with overzealous antibiotic use, which damages the microbiome, and then the complicating presence of multiple infectious pathogens, which form copious amounts of biofilm. It's not a far off conjecture to say that dampness is the main pathogen of our time and probably the most difficult obstacle to treatment for patients with chronic Lyme disease. It is a classically held tenet of Chinese medicine that old conditions we treat dampness, and that dampness is difficult to treat. Treating dampness is described as teasing oil from flour, and when deeply entrenched in the body, can take months or even years to completely rectify. So this is not a pearl that falls into a sack of flour that you can reach in and pull out. This is oil that has been seeping into that forever. It has formed dough. It has become one with the flour, and teasing those two things apart takes a long time and diligent, consistent treatment. Signs of pathological dampness that will commonly be seen in chronic Lyme patients are heavy and achy pain, a fat tongue body, a thick tongue coat, a thick white sublingual tongue membrane. This will often cover the proximal third of the sublingual area of the tongue. Skin lesions that ooze fluid or pus, episodic fatigue, mucus in stool or sticky stools that take a lot of wiping to get clean, brain fog, and many of the signs we were taught to look for in school as spleen Qi deficiency. So I'm going to hit this point over and over again. Spleen Qi deficiency is real. We do use spleen tonics when it is necessary. Most of the signs of spleen Qi deficiency that you will see in patients with a chronic infection are not coming out of that deficiency. They are coming from excess dampness. If you treat them by giving them ginseng, by giving them a lot of spleen tonics, they're going to feel better for a couple of days, and then they're going to feel a lot worse. And the water metabolism issues will be evident, and they're worsening. Very often in fluid pathologies, we will see areas of the body that are clearly displaying pathological heat and cold along with the damp signs. And while it's very tempting to reflexively reach for a cold, bitter combination when you see damp heat, and on some occasions this is warranted, when we look at dampness as primary to those thermal imbalances, we are able to cure a lot of those ailments by simply draining the excess water, which pulls the heat out with it. So you have a pot on your stove that's full of hot water. The fastest way to cool that down, cool the pot that's holding the water down, is not to throw ice in the water. It's to drain the pot. So with a damp heat situation, you want to focus more on draining dampness, less on clearing heat. Conversely, when damp cold is primary, using herbs that are gently warming in nature as you're draining dampness will kill two birds with one stone. So a lot of the herbs that we use to treat dampness as a primary pathology are warm in nature, and those are usually enough. You don't want to turn cold dampness into hot phlegm, and using too much heat can do that. But overall, we're going to err on the warm side. So when we go to treat these conditions in chronic Lyme, we rarely want to use spleen tonics in the beginning. Most of what we're looking to do is promote healthy water metabolism. So this means regular bowel movement, regular urination, adequate but not profuse sweating with moderate exercise. A lot of this can be done by adjusting lifestyle and diet and using aromatic herbs to transform phlegm, leach dampness from the senjiao, and warm and dry the spleen. When I consult with patients who are seeing other acupuncturists, the most common mistake I have seen in treating excess dampness with spleen tonics. So if you're treating a patient who you've diagnosed as spleen qi deficient and they feel amazing for 3 days, then worse, you can be assured that dampness needs to be removed, phlegm needs to be removed before spleen tonics are given again. We do tonify qi at a certain stage, but and in the Jiajian Suhetang formula, you'll see that there is sometimes the presence of a small dose of Huang Qi as a gentle Qi tonic, but we're typically not using that as the primary method of treatment, even when spleen Qi deficiency is evident. There is a lot of excess on top of that that needs to be removed before the spleen can be boosted up. So the next stage after dampness and phlegm is working on qi stagnation. So a lot of the stagnation that you'll see in chronic Lyme is secondary to that dampness or to blood stasis, which we'll talk about next. Very little of qi stagnation is primary unless patients are incredibly sedentary. But again, sedentary lifestyles tend to promote dampness as well. So there are key signs we look for when considering whether or not to use formulas that strongly move qi. And it's important to remember that when we move qi, we are also releasing qi. So it takes qi to move qi. You don't get something from nothing. You have to transmute the patient's own qi to create qi movement. And if they're already very deficient, underneath all that excess, it's possible to make people feel worse by using too much chaihu, too many qi movers. Nonetheless, especially when we are working with patients who have a chronically overstimulated and overstressed sympathetic nervous system dominance, you will see a great benefit to using harmonizing and qi moving formulas like Sinyi-san and Xiao-san. These patients will exhibit many signs of stress being a primary factor in their physiology, such as a taut or wiry pulse, cold hands or feet with a hot center, or sweaty palms. They may have a visibly taut tongue. When they stick their tongue out, it will be very rigid. They have a difficult time relaxing. Even if you're trying to do just a simple orthopedic test on them, you go through passive range of motion, they'll do it for you, and they're overperforming. And if you're using acupuncture with these patients, you'll often notice they are the types who cannot tolerate very strong needle sensation without having a vagal reaction. So like they skip breakfast, they come in for acupuncture, you try Needle Gallbladder 21 and they get nauseous and sweaty and dizzy and they look like they're gonna pass out. These people's nerves are fried. Too much stimulation or anything that triggers a sense of threat will send them into a tailspin. So they need to be, handled delicately. And again, take caution with these people when qi stagnation is primary, using very hot herbs or spleen tonics, because that can exacerbate the distress. So while depression and anxiety are very common symptoms of chronic Lyme and its co-infections, it is important to realize that the stagnation of qi that's causing those symptoms may well be secondary to dampness, and that a little qi movement can help, but too much will just make them more exhausted and stressed out. And just on the other side, a little bit of yang tonics for these people can make that qi stagnation worse. So if you're not sure which way to go, and you add futsa to a chaihu based formula and they get way worse, you know they weren't ready for futsa yet. Or you use it and they get better, you know that they're very well into those yin stages, and the qi stagnation was secondary to the yang deficiency. So blood stasis comes after qi. So once we've eliminated wind to the best of our ability, or that primary diagnosis of wind is out. Dampness and phlegm, we've been working on that for weeks or months. That's moving to the past. As people are showing fewer damp signs, they're overall fairly dry, but still a lot of qi stagnation. Starting to move that qi, they're feeling better. Usually at this stage, people's energy is starting to come back. They're out of pain, or their pain levels are much reduced, or the types of pain they experience are significantly less. So with wind, you'll see wandering pain. With dampness and phlegm, you'll see heavy achy pain. With qi stagnation, you'll see electrical or burning pain. And then those kinds of things will be less and less. And then you're on to blood stasis, which is going to be stabbing pain. So one hallmark of chronic infections is the long-term damage that they can cause to the patient's cardiovascular system. Myocarditis is one of the more easily recognized signs of chronic Lyme disease, and in more serious cases can lead to hospitalization even. So from a TCM perspective, we understand that infectious organisms can easily enter the blood layer where they cause localized heat, even when the patient presents as overall yang deficient. They're recruiting that yang qi to create that local heat, and that's draining the batteries, which then congeals the blood. And with any chronic condition that depletes qi, blood circulation, which relies on qi to happen, becomes less efficient. And then, of course, many patients with chronic pain or fatigue will become sedentary, and that sedentary lifestyle will then lead to blood stasis as well as accumulating dampness and stagnating qi. So the signs of blood stasis to watch for in chronic Lyme patients are fixed pain that is worse with localized pressure. So a hallmark of Bartonella infection particularly is damage to the blood vessels that caught on the bottom of the feet, and that causes a stabbing pain down there. So very often they'll say like they get up out of bed and they're just scared to touch the floor with their feet. They start off with a very sharp pain in the bottom of the feet. They start walking, it might spread out, it might decrease a little bit, but these are people who they wish that they had a personal hover belt to float around through life on, because the bottoms of their feet are just so painful. You'll see engorged sublingual veins on these people's tongues. You'll see a purple hue to their lips or their fingernails. They will very often experience heart palpitations, large blood clots in the menstrual cycle, and painful period cramps are, of course, signs of blood stasis. Now, whereas with dampness, when both heat and cold signs are present, we typically want to err on the side of warming. But like I was saying in the damp section, you can somewhat ignore the thermal nature that's associated with dampness, because your primary treatment is just to drain dampness, and the heat will go with it. Or if there's a lot of damp cold, draining damp will allow more qi to circulate in that area that will then naturally warm those parts of the body. With blood stasis, you need to pay careful attention to the thermal nature that is accompanying that situation, because heat in the blood needs to be treated by cooling the blood, and vice versa with blood cold, where the use of yang tonics such as rolgui, futsu, or wujiyu is essential. So you see somebody where there's a cold type of blood stagnation or blood stasis situation, you can use herbs like dangui, of course, the classic combination of dangui and quanchong is slightly warming. Dangui tonifies, quanchong moves. Both of them have a little bit of action on the other side of that equation. But then you add a little bit of guizhi, a little bit of rolgui to that. All of a sudden, you're warming, and you're most of the way towards a formula like dangui sinitang, which is like a classical blood cold situation. If you misdiagnose the thermal nature of a patient with blood stasis and you treat them incorrectly, you will know right away, as they will immediately worsen. You will get, so if you think that someone is blood cold, you start giving them blood warming herbs, blood moving herbs that are warm, and they actually had heat in the blood, they will get real angry and usually tell you, or their spouse will tell you. So that's the excess side of chronic Lyme disease. And again, that's most of treatment. So whereas a lot of chronic Lyme patients are yang deficient, are blood deficient, are qi deficient, or yin deficient, and I'm going to go through those patterns next, the excess is more important. You're treating an infection. That is something that was not present in the body before. It's something that nobody is deficient in, an infectious organism like Borrelia. And so using tonics right at the beginning, unless you're very experienced in this area of treatment, is kind of a pitfall. You can use them diagnostically if you suspect that a deficiency is primary, but typically we want to err on the side of reducing excess rather than giving people tonics. The exception to that being yang tonics, which is the foundation of really looking at this from a Shanghan lens. but I'm trying to stick more with Zang Fu and eight principle treatment for this lecture. Although I will talk about yang deficiency here. So now that we're through the primary excess patterns that you'll see, I'm going to briefly cover the deficiency patterns. It's common to notice these on the first visit, but if you begin by tonifying your patients, they will most likely accuse you of dumping your herbs and their money into a black hole because they will feel no changes or will worsen. In the beginning, you need to prioritize treating any excesses you see in the order of wind, dampness, qi stagnation, and blood stasis. It's okay to include nods toward all four of these in your formulas if you're an experienced herbalist, but otherwise relying on the wisdom of the physicians who created our classical formulas that have stood the test of time is the way to go. Even though I harp pretty strongly against using tonics too much in this lecture, it is important and very interesting academically to note that in Xiao Chai Hu Tang, probably the #1 formula in the world for chronic infections of any kind has renshen in it, that has ginseng. So doing a bit of research a few years ago, I found a really interesting biomedical study on ginseng and its ability to decrease quorum sensing in opportunistic bacterial growth. So quorum sensing is this really cool phenomenon that some kinds of pathogenic bacteria have to communicate with each other through the body about like what areas different colonies of the bacteria are growing in, and it's part of how they evade antibiotics and learn to adapt to specific antibiotics is through quorum sensing. They can communicate what sort of predators are in their environment and then develop resistances and increase replication as a result of that. So it's we know that Zhang Zhongjing, who wrote the Shanghan Lung, was a genius, and he put a little bit of ginseng into Xiao Chai Hu Tang, which combined with Chai Hu, Hongqin, and Bancha, those three herbs that make the wind, heat, and phlegm relieving component of the formula, putting a little bit of ginseng in that hallmark Shaoyang formula is not without some benefit. But be careful. So a little bit is, it's decreasing the ability of those bacteria to communicate with each other and reducing their ability to develop resistance to anything else that is killing them in the body. But too much, you're going to be adding, all of the ginsengs, they tonify qi and water, or qi and yin, and too much of that is going to negatively affect your patients. So even when you're well into the stage where you feel that most of your patients' excesses have been removed, you may be surprised. This has happened to me several times. Over tonifying will easily reveal hidden pathogens that have not been eradicated. And this is also why classical formulas indicated for recovery from chronic illness, such as Lingui Zhugan Tang, oftentimes contain only food-grade herbs and not strong tonics like ginseng. Okay, so we're a little later than I thought we were going to be, but here's my first polling question. So remembering back to the section on the Herxheimer reaction, if a patient experiences a Herxheimer reaction as a result of treatment, should that patient, this is true or false, should that patient discontinue taking herbs? True or false? I'm going to give you all a moment to answer on the screen. Hopefully everybody's chosen by now. And so the answer is false. Patients should not discontinue taking herbs. The exception to that will be if they were admitted to the hospital and the hospital doesn't want them taking anything other than what they're giving. But like I said, I have never seen that scenario in my practice. Usually you want them to continue taking herbs at a dose that they are tolerating very well. Okay, so first deficiency syndrome we're going to cover is qi deficiency. So we're going to go in the order of qi, then blood, then yin, and then yang. So you can be assured that any patient dealing with a decades-long history of chronic infections is going to be deficient in qi. Even if they don't show obvious signs of it, they're getting hollowed out from the inside, and it is only a matter of time until they collapse. Once they're ready for tonics, they will respond like a champ. Their pulses will fill out very quickly. They will feel like $1,000,000. And the challenge for you as the clinician will be to keep them from burning themselves out. So with the newfound energy they now have. So be cautious not to over tonify, because even though they're qi deficient, when you administer qi tonics at the right stage, they probably still have a fragile and weakened middle jiao. And many patients will respond to too much nutrition by getting clogged up with new dampness, and then they may believe they have relapsed. They may relapse if there's still a lot of pathological load present, but they may just feel waterlogged, bloated. And what actually should have done is you could give them a little qi tonic, but you just gave them too much. It's sort of like, when you're hungry, you eat a little food, you feel good. You eat too much food, you get food stagnation, you feel bloated. One more note on ginseng: it's contraindicated when a patient has helminths. So I haven't talked about parasitic infections here very much, but they are another co-infection that chronic Lyme patients tend to deal with. So when you're constructing formulas with qi tonics, we tend to use things that are a bit more gentle than Renshen. So we'll use Wu Jiashen, Huang Qi, Bei Sha is a very gentle yin tonic that has a little bit of qi and isn't cloying. Treating parasites is a whole other lecture, but looking into the formulas like Wu Mei Wan, and then the anti-helminthic herbs in our pharmacopoeia can be fantastically helpful. And Wu Mei Wan is for Joyen syndrome and obvious parasitic infections. But you want to be cautious using ginseng if you know somebody has worms for sure. The worms just eat that up. So since we're in the qi deficiency section, I want to break down one of my favorite formulas to use here. This is Linggui Zhugantang. So I mentioned this briefly before. This is 4 ingredients. So Fuling, Guizhi, Baiju, and Gansao, licorice. So we've got Poria, cinnamon, atractalodes, and licorice. So this is a tie-in kind of a formula. The first herb, Fuling, is going to drain dampness more than it tonifies, but it does have a little bit of spleen tonifying action. It balances blood sugar really well, and it's a mild diuretic. Guizhi, of course, is cinnamon twig, so you're adding yang to the body. This tonifies yang in the heart, in the spleen, and gives an overall warming characteristic to this formula. Baiju, the third herb, atractalodes. This is warming and drying for the spleen. It's very gentle. So it does add a little qi, but more so, again, it's just getting that water out of the way. And then it also has a lifting quality. So the spleen, of course, loves to lift, holds things in place. But when it's oppressed by dampness, it has a difficult time doing that. So Baiju is adding a little bit of a lifting action, and then combined with Guizhi, which has a very wood yang action of moving up and out, this is getting that warmth and qi and water. The spleen needs a healthy amount of water, not too much, from the spleen up into the lungs, where it can then rain back down over the body. So, and then Gansao is also very sweet and gives a lot of nutrition to the spleen, but isn't like sugar. So this formula overall is very warming, very drying, and then but is able to moisten other tissues by using the lung to rain that healthy water back down through the body as a whole. You can use this as a constitutional base for other formulas. You can add more anti-phlegm herbs to it. You can add anti-wind herbs to it. You can add blood-moving herbs to it. It's one of my favorites to start using at this stage of treatment. Blood deficiency. So whether the patient is, I just lost my place in my notes. So whether the patient is female and has had heavy cycles for a very long time, or been on a long-term vegan diet, or sweated too much, even therapeutically, blood deficiency is a very common pathology, and very common, we'll see this with chronic Lyme patients. So the chronic infections themselves, by depleting qi and inhibiting absorption, also deplete blood, and especially the formation of new blood. And this is evident in the architecture of classical formulas indicated for the first treatment of Gu syndrome, such as Jiajian Suhatang, which contains both Dangui and Chuanqiang. So when a patient is at the stage of treatment where tonifying blood is indicated, so we've been through all the excesses, we've done a little bit of gentle qi tonifying, they're still showing blood deficient signs, they're not making blood on their own, we're going to give them some blood building herbs, meaning we still need to be cautious using formulas such as Suwutong, because again, these patients tend to have a weak middle jiao, and very cloying substances like Shu Di Huang will only cause them to collect more dampness. We must never forget that blood tonics work by turning qi into blood, not adding blood directly to the body. You're not transfusing the patient. You are giving them something that takes qi and builds blood out of that. So if there isn't enough qi, you can't engender blood. And then next up is yin deficiency. So just as we mentioned with the blood tonics, we need to be cautious when using very yin substances in patients who have been through treatment for chronic infections and inflammation. So while Shudi and Tianmendong can be amazing for they have like these steroid-like qualities, and you need to always combine them when you deem them necessary with substances that aid digestion. So things that help the patient break down that stuff, like Chenpi, Baiju, Fuling, Shazhen, etc. And in the theme of attempting to underemphasize the use of most tonics in chronic Lyme treatment, I will say that yin tonics are probably the largest potential pitfall that Zang Fu trained practitioners will encounter. If you are wondering whether or not to use a yin or yang tonifying approach, typically just go for yang. The fire spirit school method born out of Chengdu and its fondness for hot drying herbs and a Shanghan-based approach cannot be ignored here. So while yin tonics like Shudi, Guiban, Bieja, Pashou Wu, Tianmendong, etc., have a long and cherished history of use, it is important to notice that in many cases, especially where we're treating the follow-up of a long-term damp kind of syndrome, they're often administered in the presence of fragrant or aromatic medicinals. And these are like sharan, like I mentioned, cardamom, bidokol, salguo, or other cardamoms, sangju, xiaohuixiang, fennel, etc. So as that they're not too cloying. These things aid in digestion. And just as blood tonics require qi to work, yin tonics require jing. So if the patient is completely depleted of, well, if they're completely depleted of jing, they die. But jing is much reduced from having suffered a long-term chronic infection like this. They're going to need a lot more time to recover, and they may never be as strong as they were before they were ill. So there's a self-cultivation journey and adventure. I mean, that's part of aging for all of us, but for patients with a chronic illness, a chronic infection, as they get closer and closer to remission, as they go deeper and deeper into recovery, they're oftentimes going to discover that they have limitations they didn't have before they got sick. And sometimes what they discover is that they actually had those limitations before they got sick, but they were ignoring them. They were able to power through them. Their capacity for burnout and recovery is going to be a lot less. And so if you're used to looking at people as yin deficient when they're burned out and hollowed out by overwork, by not getting enough sleep for many years, by sweating too much, by being in sympathetic dominance 95% of their day, helping them come to the conclusion that they need a significant lifestyle shift is therapeutically very valuable, and bring that mindset into chronic Lyme treatment. And then yang deficiency. So when I went to TCM school, yang deficiency was pretty heavily underemphasized as a pathology pattern, and with good reason. We didn't see a lot of yang deficient patients in the school clinic. Most of them are laden with excess, but underneath have very limited deficiency patterns, and they would not exhibit signs of vacuous yang qi until they're quite aged, well into their 80s or so. And so prescribing long-term use of Rogwei, Wujiyu, Futsa to these patients can be dangerous or dreadful. But this is not the case with polymicrobial infections. So again, similar to The other deficiency syndromes that I've been talking about, patients may not display obvious signs of yang deficiency at the beginning, but you can be assured that that deficiency is present. They've been getting hollowed out for a long time by the infections. So if you're confident in your diagnosis, but your treatment goes nowhere, this in the beginning stages, you can consider dipping your toes into the water of the fire spirit school method by adding some cinnamon or some aconite to your formula, or see if your constitutional assessment of the patient was incorrect and they require something that's a little more obscure like Wuji, that's Evodia. If they respond, you will know you're now on the right track and slowly be able to reattune your future assessments to be more successful from the beginning with your next patient. So kind of the classic scenario is we don't use yang tonics at first, we're just removing pathogens. And then, stage 2 is 50-50, build yang back, continue to remove excess. And then stage 3 is just, Huyang, to support the yang qi. But there are exceptions to that, especially in older people. You can use Futsa right at the beginning. So as I mentioned before, dampness is often the predominant pathological factor in treating chronic Lyme, especially in the excess stages. And just as we want to err on the side of warming and drying when addressing dampness, we can also err on that side with our formulas overall. So there is a great classical foundation for using Futsa as a single herb or Sinitang as a 3-herb combination to a constitutionally appropriate formula that does not typically contain these ingredients as a way to give it a powerful therapeutic boost. And Sinitang is for yang collapse, and that's Futsa, Shengjiang or Ganjiang, and Gansao. So aconite, ginger, and licorice. Chronic infections love cold and damp environments. And by warming, by fumigating our patients, we're able to turn their bodies into a place where the critters are unable to live, or at least very unhappy with their lifestyle and looking for a way to leave. So Borrelia as an organism is a spirochete. So its closest relative in the world of infectious disease is actually syphilis. And we don't see a lot of syphilis in TCM practices, but it's not nearly as common as it used to be either, but because we know how to prevent transmission effectively with barrier methods. But in the old days when syphilis was going around all the time, the best way to treat it before antibiotics were available was to induce a high fever. And so it's dangerous to do this. Like this is something that requires very close medical supervision. But sometimes people with a lot of yang qi even would create their own exceptionally high fever. So this is like 105, 106 degrees. It's dangerous. They stay up there too long. It's going to cause permanent brain damage. Turn your brain to scrambled eggs. But the bacteria can't survive at that kind of body temperature, and so it will die. And if they come back down out of that and they're still healthy and they live through the treatment, or they live through the fever that their body produces, they're then cured of syphilis. So the same thing can go for Lyme, for many other bacteria, for many viruses. They have a very narrow tolerance level, and fungal infections too. They have a very narrow tolerance level for the temperatures at which they can survive in the human body. And that's like I said, a lot of these people can't produce a nice high fever. You get them to a place where they're able to, you're on the right track. And sometimes that, I have treated people where they were able to produce a high fever. They caught an acute flu or an acute virus or something that triggered a high fever for them, even like a stomach flu from foodborne poisoning. And afterwards, they feel like they're a ton better. That fever clears, and all of a sudden, like many of their Lyme symptoms will just be gone. They're probably not completely out of the woods, but it's a good sign. So I want to talk a note about heat here, because whereas in TCM school, especially, clearing heat is often a primary therapeutic method we like to use, and there's great and many places where you want clear heat. You want to use those cold bitter herbs. When we treat Lyme, it is secondary to moving out water. So it's true that many heat clearing herbs will have a direct antimicrobial action and are able to kill bacteria. And we do use them frequently, but we will often use them as single herbs or a doyao pair that's added, or like a mini formula that we tack on to the context of a warming, drying formula as a whole, because cold herbs, when overused, one, they're frittering away the patient's yang qi, and two, they're making it more susceptible to further damage down the road. So I haven't talked a lot about heat and cold as direct excess pathologies in this lecture. Heat is usually in these patients, it can be primary, but that's unusual. It is typically secondary to an accumulation of dampness. You get the compost pile effect where you're layering damp material on top of itself, and that's congealing, compressing, and it creates its own heat. You throw something cold at that, it puts out the fire, but then it's just going to start right back up again, and it's just going to it's making the dampness worse. Um, the treatment is to drain the dampness. And excess cold looks more like yang deficiency. And we actually use a lot of the same herbs to treat excess cold that we use to treat deficient yang qi. So you use the aconite species. Maybe you use more like Chuanwu, Wuto, or Sawu instead of Fuzi. Fuzi is more tonifying. Chuanwu is more reducing, but it's the same plant. They're different parts of the same plant, and they have a very similar and related action to each other. Excess cold, you can also use cinnamon in that scenario. You have cold damp in the liver, you can use wujuyu in that scenario. So the difference between excess and deficiency is less important when you're dealing with cold than it is with heat. Vacuous heat, of course, that's coming out of a yang flaring kind of scenario. So you in a TCM situation, you'd use yin tonics for that to cool that down. In this scenario, when there's empty heat, much more often we're going to start looking at using yang tonics that have an anchoring quality. So Fuzi will, of course, recharge the batteries of the patient. Rogui directly warms the Mingmen, and then using herbs like shaoren, cardamom, especially when it's fried in salt, is going to have an anchoring effect on the body's yang qi. It's going to pull that flaring yang back down into the kidneys, which is where you want it to be, so that that's warming water from underneath and supporting the body as a whole. So in on time. Okay, so in terms of formulas that I like to use for those different stages of treatment, I'm going to just list off a couple of the more commonly used ones. This is not an exhaustive list, and there are certainly going to be more formulas, more combinations than I'm able to discuss here. But these are just some of the more common ones. So if you want to get a starting point for where to pour your studying knowledge, where to open up Bensky, where to load up American Dragon, and start memorizing ingredients of formulas, this is where you can start with. So for wind, for the initial stages of treatment, we're looking more at Jiajian Suhetang. So that's the basis for like thunder and lightning pearls in the classical pearls line. And like I said, Heiner's written extensively on that formula, and his article will teach you kind of tease apart herb by herb and show you the relationships between those herbs in that formula, which is great. It's easy to modify, and it's, like I said, it's very gentle in its action, so it's very safe. Guizhitang, and then other cinnamon formulas like Guizhijia Pai Tang, Yin Chaosan, Chaiga Jieji Tang. When we're getting into dampness as the primary pathology, we're looking a lot at the Bancha family of formulas. So to transform phlegm. So of course, Erchen Tang is kind of the, that's the main one in that category. And then you have things that branch off of Erchen. Of course, you've got like Pingjia Tang, Wendan Tang, Haoqin Qingdan Tang, that kind of family. They're still very much in the Bancha picture. San Ren Tang, which is a wonderful formula. I didn't learn that formula in TCM school, but it's become one of my favorites, that aromatically warms the body with Bidoko, and then is draining dampness through the triple warmer in all three jiao. So that's a great long-term formula for patients to use when you're in the damp stages of treatment. Erjutang is based on the combination of Baiju and Sangju, so both kinds of atractaloads. That's an easy tack on to Er10. And then Lingui Jugantang, like I was talking about, that 4-herb combination. Dayuanyin is a great formula for when someone's been improperly treated or with blood moving herbs too early, or when the dampness has leached into the moyuan. This is like deeper into the collaterals, and the dampness becomes much more resistance to treatment using damp draining and phlegm transforming herbs. Daiwan Yin uses some sour and cold things to actually astringe the action of the formula deep down into the moyuan, and then pungently pushes it out from there with salguo. It's a very interesting formula, and has a lot of application to like long COVID and other damp scenarios like this. And then this one's a little bit more for wind, but still very much a wind damp kind of scenario is Hoshang Jiangqi. So, we all learn this in school for food poisoning, but it actually has an incredibly powerful action on wind, cold, damp. So that's somewhere between wind and dampness, but wonderful formula and something you can use that architecture to base other formulas on for chronic Lyme. Looking at qi stagnation, of course, the cardinal formula for this category is going to be Sinisan. So that's Chaihu, Baishao, Dersher, and Zergansao. And that's promoting circulation from the core out to the extremities. Related to that are other Chaihu-based formulas. So Xiaoyaosan, Chaihu Shugansan. And then one that doesn't have Chaihu but is great for qi stagnation is also Yujuwan. So this uses Zang Fu as a qi mover, and they use that less commonly. But it's still good to know that there are other qi movers besides Chaihu in our pharmacopoeia. Chaihu gets emphasized a lot of the time. Blood stasis, when we're getting into there, of course, there's the Juyutang family. So Shuifu Juyutang, Gasha Juyutang, Shaofu Juyutang. When you have a qi deficient blood stasis kind of scenario, so blood is stagnant because there isn't enough qi to push it, Buyang Huanwutang is great. This is the #1 formula for stroke recovery in China, but it's also very useful for other neurological things going on when there's blood stasis in the upper part of the body because the qi just can't get up there. And it pairs well with wind releasing herbs. And then in the lower part of the body, Guizhi Fuling one. So Guizhi, Fuling, Taran, Mudanpi, for circulating the pelvic area. This is great for lower jaw blood circulation. And then, of course, when we're dealing with blood stasis, but it's not the primary pathology, it is still often good to move a little bit of blood, not too much, but you can even do that at the very beginning when treating wind if you know what you're doing. And you just use a Duiyao pair for that. So you just use like Taoren Honghua, Sangleng Eju, Rushang Moyao, something like that. Maybe a bug, maybe something like, Dilong earthworm, or less commonly, but more often with like neurological syndromes, Bell's palsy, that kind of wind and blood stasis mix, wind phlegm and blood stasis mix. You can use things like Wugong and Chuanxie, scorpion and centipede. Qi deficiency. So, I've been kind of underemphasizing that as a pathological factor in this lecture, but the common qi tonifying formulas that we all learn in school are appropriate at certain times here. So, Buzhong Yi Qi Tang to lift qi, while tonifying, Buyang Huanwu Tang, like I just mentioned in the blood stasis section, and then Li Zhongwan, but more specifically, Fuzi Li Zhongwan. So, when I was in TCM school, Fuzi Li Zhongwan was really de-emphasized as a formula. I will say in chronic Lyme treatment, it is wonderful and so powerful that Fuzi is just a magical herb for this, for these patients. They need to take it for a long time, but they tolerate it well, and eventually it makes a world of difference for them. Blood deficiency, where again, once qi has been built back and blood tonics work, you can start giving them to people. So Dangui Sinitang is a very common formula for blood cold and blood deficiency. That's not how it's described in the Shanghanlun, but it does work that way from an 8-stage therapeutic perspective. Taohong Suwutong is Suwutong plus Taoren and Honghua. So that's tonifying blood and creating a little movement so you don't get blood stasis just from adding tonics. Swanzarentong for people who are heart blood deficient and not able to anchor that yang qi in their heart at night to sleep. And then Dangui Bushui Tong I especially like because that's just a 1-to-1 combination of Huang Qi and Dangui. So actually, sorry, that dose is not correct. It's not 1-to-1, but it's just the 2-herb combination of those two. You can add that as a pair to other formulas, but it's using Huang Qi to tonify blood and then Dangui to use that, or sorry, Huang Qi to tonify qi and then Dangui to use that qi to build blood. And then for yin deficiency, you've got all your classic TCM formulas, Di Huang 1, Zolgui 1, etc. Yang deficiency, a bit more diverse. A lot of possibilities here. So Sini Tong, like I mentioned before, Feng Sui Dan is a very interesting yang deficiency formula where you're using salt fried cardamom and Hong Bai, which is a very cold herb, but you're actually using that to anchor yang qi back down in the pelvic area and the kidneys to build yang qi back. Qian Yang Dan is that Fuzi Sharan combination. Dangui Sini Jia Wujiu Shengzhang Tang. So this is Dangui Sini Tang plus Wujiu and ginger. Lingui Jugan Tang, like we talked about, and anything with cinnamon is going to be tonifying yang a little bit. And then, I call Wujiu the bastard redheaded stepchild of yang tonics. It's de-emphasized in TCM school a lot, and if prescribed incorrectly, you will know right away. But Wujiu is one of the most powerful herbs in our pharmacopoeia, and when you learn to use that correctly, Wujiu Tong is a magical formula for getting people out of a cold, damp situation. So that's most of what I've got to cover. I'm going to ask the second polling question now. So if qi deficiency signs are seen and tonics made the patient worse, what is your appropriate next move? And this is going to be multiple choice. So your options are A, tonify qi more, B, tonify blood, B, move blood, or C, drain, that would be D, drain dampness. I'll give you a moment to answer those. Hopefully everybody's clicked their selection and made the right choice. The answer is that last one, D, it is to drain dampness. Okay, so that's the lecture. If we've got any time left over, I will, and there are more questions that people are asking in the chat, I can answer those. And then I hope you've enjoyed this. I hope it's been helpful. Please reach out if you have questions after the lecture, and have a great rest of the day, and hope you enjoy the rest of the symposium. Thanks, everyone.